Hi, it's Dr. Moore Keystone again. I'm here to talk to you a little bit about diabetes. So, diabetes is one of the most common healthcare conditions in the United States today. It is when the body has too much sugar floating around in the blood and can cause damage to the body. It is because of this simple feature that diet is the most important piece of treatment in prevention and treatment of diabetes. The whole problem with diabetes is that there has been too much sugar consumption for too long, causing a decreased ability for the body's cells to absorb sugar for energy. A frustrating fact about treating diabetes is understanding what sugar actually is and where it comes from. Sugar is a simple molecule that virtually every cell in the body needs to work properly. Sugar comes from the macronutrient group of carbohydrates, which consist of foods like breads, pastas, pastries, crackers, even dairy products, etc., which basically seems like every good food. But when it comes to diabetes, even some healthy foods can have increased carbohydrate content, and they can spike your blood glucose and set your A1C level goal back way too far. Nutrient intake in diabetes should focus on maximizing protein and fiber intake, limiting your simple carbohydrate intake, and increasing complex carbohydrate intake, which are your vegetables. Vegetables are carbs, but they are a complex form of carbohydrate that make it harder to break down and won't spike your blood glucose like simple carbohydrates will. Diet must always be individualized when dealing with diabetes. And it's also very important to remember that depending on where you're at in your hemoglobin A1C and what kind of side effects you have with diabetes, sometimes additional medications must be incorporated into your treatment regimen to ensure more efficient glucose absorption.